Senate Republicans are making a last-ditch effort to repeal Obamacare again. And look sharp, they are getting really close to having the votes to pass it.
This bill would impose fundamental, sweeping changes in the Medicaid program.
The American public hates the American Health Care Act.
Here, sweetie, just one little pill tonight. That's from memory.
But is it real? Is it real? It's intellectually inconsistent to say in 2018 we're going to come back to repeal and replace. We're going to.
Remember this guy?
Take back your service flag, mother. Your son's in the ASDP. Or hip,
you look like a proud
hip hooray.
Army guy.
Oh, we're living in the USA.
Yeah.
Come on and sing, let freedom ring. Hip, hip, hooray.
Do you remember how you felt in that uniform?
Well, it was dicey.
Dicey?
What I have is, what do you call it, memory lapse to some degree. I can tell you I was born in 1923, and I have had a very good life. Happy to be alive. I like people. I like to do things. I like to go places.
So we're going to go up to Father Demo Square. You know, nobody misses anybody except if Ty's not there, because Ty's always asking questions and he's always talking and he's always making jokes.
I'm 194 years old.
God, you don't look a day over 193.
Yeah.
How are you, Ty?
Now I feel better.
Good.
Want to give me a kiss?
Another one.
Hi, Stacy. I'm Ann. Nice to meet you.
Good to meet you.
And this is Ty.
My name is Stacy Sanders, and I'm the Federal Policy Director with the Medicare Rights Center. We urge Congress to support these essential programs and secure. So I oversee all of our federal policy and advocacy initiatives in Washington, D.C. So I was here talking to Ann about her experience caring for Ty. He has Alzheimer's disease, and in particular to bring her voice and her experience to the debate that's going on right now about the future of Medicaid and the future of the Affordable Care Act.
Yeah.
You're the best.
Well, he seems very social.
He is very social. Yeah. One of the reasons why it was hard at the very beginning, when I saw signs of memory loss at the beginning, not only was it hard to talk about, and so I pretended it was okay, but Ty is somebody that doesn't fuss about the minutia of life.
Thank you for riding the Staten Island Ferry.
You're welcome.
I calculated once that if all of our Medicaid was cut, and what Medicaid is providing us is the Melinda and Esperanza, the home health aides, as well as incontinence supplies, diapers and pads, as well as it's our secondary insurance to Medicare. So I calculated that it would cost about $7,500 a month to replace all of that.
Wow.
And that's absolutely impossible, and made more impossible if I couldn't work and didn't have that income to supplement. So it would be quite a disaster.
I think I'm struck by just how much Ann does for Ty.
Ty is the love of my life. And we've had so much fun together and done so many wonderful things together, so that caring for him is, I've talked mostly about its burdens, and that's what I think about a lot. Sorry. It's okay. It also has its joys to be able to make his life as full and rich as possible.
Somebody else.
And I'm also very lucky that he appreciates all that I do, and he thanks me all the time and acknowledges that.
Let's
Do it.
Let's fall in love. We did fall in love, baby.
Yeah, we did.
You know, I go back to Washington, D.C., I talk to other lobbyists, I talk to other advocates, I talk to folks on Capitol Hill, I talk to folks who administer Medicare and Medicaid. And, you know, our job is really to bring your story to them, to bring your perspective and all of the things that you worry about so that we can try to protect these programs.
To the health care battle raging on Capitol Hill, the Senate is bracing for a showdown next.
This fight's not over. And the Medicare Rights Center is going to be there. We were there yesterday, we're here today, and we're here for the long haul.
What a wonderful day today, sweetie.
It was a good day.
It was a good day.
It was a good day.
And it was a lovely evening, too.
But I think everybody had a good time.
I think so, too. And it was wonderful listening to Peggy Lee with you, sweetie.
Yeah.
It was so nice.